Earlier this week, Governor Cuomo unveiled new cluster action initiative, which maps areas throughout the state that have seen COVID upticks in recent weeks. There are 3 levels of restriction for cluster zones shown on colored-coded maps. The highest risk areas are red, surrounding areas are orange, and precautionary spots in yellow.
Clusters, all of these areas, you can look at them exactly by the cases. It's not by zip code, it's not by census tract, it's not by any political metric, it's only by the number of cases.
On Thursday, the city began enforcing new restrictions for COVID cluster zones in Brooklyn and Queens. Mayor de Blasio warned heavy fines up to $15,000 a day for violating the rules of mass gatherings and fines up to $1,000 a day for social distancing and face covering violations. Red zones are defined as an area with 3% positivity cases on a 7-day average. This school behind me, along with others in this area, will be shut down for 2 weeks, but it could extend up to 4 weeks depending on updated coronavirus indicators.
So in the red zone, all schools would be closed. In this case, they already are, all public and non-public schools. All non-essential businesses in the red zones will be closed as well. Mass gatherings will be prohibited. Restaurants will revert to a takeout-only status, and houses of worship will be allowed to have 25% maximum occupancy.
Schools, high-risk businesses, and indoor dining in orange zones will also remain closed for 2 weeks. Places of worship can have up to 33% capacity, and yellow zone areas will remain open. Anna Fusco, a Brooklyn resident who lives in an orange cluster zone, felt indoor dining and in-person schools wasn't a wise decision, considering the uptick in positive cases in the city.
These are micro events of success that are now maybe unfolding again, so in a bad way. So whatever needs to be done to protect people, I think until there's a vaccine, until we have an idea of where our health care system is going to be, it's really, we should be concerned for the health of people.
As cluster zones continue to spread in Brooklyn, Queens, and upstate counties, the Bronx is one borough you don't have to worry about as of now. Executive Director of the Bronx Public Health Office at the New York City Department of Health and Mental Hygiene, Anita Reyes, says since the early stages of the pandemic, they have been working closely to identify the affected areas using a hyper-local approach.
We really looked at areas where we're high traffic area, but areas where we could partner with community residents. And so we decided to set up a testing site at these locations. And this is a joint effort with City Hall, with health and hospitals, with the health department, with the test and trace team. So it's a multiple agency approach. And what we noticed is that we wanted to put more testing in these communities because we saw that people weren't getting tested. So let's meet them where they are.
To find out if you live in a cluster zone area, you can visit nyc.gov. Reporting for BronxNet, Ashley Tiffaney.